Authorities are expressing concern over Filipinos' increasing resistance to antibiotics due to wrong ways of medicine intake. This leads to a person developing what the World Health Organization calls the silent pandemic of antimicrobial resistance, or AMR. It has caused millions of deaths these past few years and projected by some studies to peak at 10 million yearly by 2050. So what are the proper ways of taking antibiotics so that you can avoid developing AMR? Joining us now is Dr. Melissa Guerrero. She is the director of the Health Department's Pharmaceutical Division. Good morning, Dr. Guerrero. Thank you so much for joining us. Now, first of all, talk to us about the data. How prevalent exactly is AMR here in the Philippines, and how serious a public health problem is this?
Yes, thank you, Ms. Ria, for the question and for this opportunity for the Department of Health to inform the public about antimicrobial resistance. So the classic example is TB drug resistance. In the Philippines, we have, for example, around 2% of new infections as being drug resistant to the first-line TB treatments. And we have a lot more data on increasing drug resistance rates for common pathogens. So even for common pneumonia, for example, we find it hard to treat them with first-line antibiotics and instead resort to second-line antibiotics, which are more expensive for the consumers.
So, doctor, what exactly are the causes of AMR? How does a patient develop this?
There are many causes of antimicrobial resistance. So one is improper use of antibiotics. So on account of, for example, when you self-prescribe antibiotics and you do not consult your physician, or you do share prescription, so the prescription used by your sister or your mother, because you have the same symptom, you use the same antibiotic. So it's not automatic that you have the same infection and therefore you should use the same antibiotic. There are also factors contributed by physicians. For example, when they do irrational prescribing, so for example, it's a viral infection and you treat it with an antibiotic, which is unnecessary for treating common viral infections.
Now, it's a bit scary because this has been called the silent pandemic. When you do encounter a patient with AMR, what are the available treatments and what do we need to do now in the immediate term to address this so the problem doesn't get worse?
There are antibiotics that are indicated for drug-resistant infections. However, over the years, we have seen that the production of new antibiotics have been dwindling. And this is the reason why we are calling the attention of physicians, of patients, the public, to preserve the antimicrobials and to properly use the antimicrobials only when needed. What are we doing? So we're seeing now, for example, TB patients. So they cannot be treated with the first-line treatments like rifampicin or isoniazid. Instead of being treated only 6 months, now they get treated for at least 9 months, and sometimes they're not healed. And that results in more mortality rates and even more expensive treatment for the family. There are ways to treat drug-resistant infections, but again, they are more unwieldy.
Okay, so
the government...
Go ahead.
Yes, Ms. Ria. So we are doing something in the government to educate the public, and we are doing multifaceted approaches in approaching drug resistance. We have the Interagency Committee on Antimicrobial Resistance because it's not just a problem in human health. For example, the improper use of antibiotics in animal food. So the chicken that we buy, so some of them are treated unnecessarily with antibiotics. That's why we partner with the Department of Agriculture for them to also educate the veterinarians on the proper use of antibiotics in food animals because they do contribute to antimicrobial resistance. So this is a multi-sectoral effort by the government. We have an interagency committee and addressing this problem on a high-level policy making process. So we issue regulation. For example, the FDA, our Food and Drug Administration, is very strict when it comes to monitoring the dispensing of antibiotics by our drugstores. We do have the no dispensing, no prescription, no dispensing policy, meaning that if you go to a drugstore, the pharmacist cannot just issue an antibiotic without the proper prescription.
Right. You need to have all the proper documents and prescriptions with you. Now, with all of that said, doctor, what are your quick tips on how we should take our antibiotics properly at times when they really are necessary?
First is to properly consult a doctor. So you do not assume that every cough or cold is caused by a bacteria and therefore necessitating the use of antibiotics, because the more that you use the antibiotics, the more resistance happens. Do not self-prescribe, and then do not share prescription with your neighbors or your family, because that will also increase drug resistance. And for the physicians, our main concern is really the improper use, the overuse of antibiotics, even now with the COVID-19 pandemic. And this is a viral infection. So we have seen, for example, some anecdotes of antibiotics being prescribed for COVID-19 patients. And therefore, last year, when we did have the awareness campaign, we issued that advice to the public and to the physicians to, as much as possible, do not use antibiotics just for COVID-19 infection. It has to be documented. So you have to be doing the culture and sensitivity before using antibiotics for any COVID-19 infection. So we continue to raise awareness on this, and we thank you, the media, CNN Philippines, for helping us reach the public with these important messages.
All right, thank you for that, Doctora. Very informative. That was Dr. Melissa Guerrero from the DOH.